the law in Ontario is quite clear that patients cannot be treated without consent, and that is either consent of the patient themselves if they're capable, or consent of the substitute decision maker if the patient has been found incapable. But that is the norm. It doesn't cover all circumstances. So in this video, I want to cover what actually happens in an emergency when there isn't time to get consent, or there's a language barrier, so it might not be possible to get consent even if the patient is capable. So it's a bit of a lengthier section, but I thought I would share it on my screen and go through what happens in an emergency, because there are actually some exceptions when it comes to needing consent prior to rendering treatment. So here is the emergency section. This is the Healthcare Consent Act. So section 25 tells us that if for this section and the section that follows, there is an emergency if the person for whom the treatment is proposed is apparently experiencing severe suffering or is at risk, if the treatment is not administered properly, of sustaining serious bodily harm. So what that tells us is emergency is a pretty high standard. There's a lot of things that would maybe need urgent medical attention, but wouldn't necessarily fall under this language of they seem to be experiencing severe suffering or they're at risk of sustaining serious bodily harm. So there's a lot of reasons somebody might call 911, for example, that they're using emergency services, but it's not actually an emergency as defined in the Healthcare Consent Act. So this is a really important part of it, is it's kind of reserved for the more exceptional circumstances where not treating a person might be leaving them in significant pain, or they might have long-term bodily harm after the fact because the medical issue is not addressed promptly. So it kind of narrows the definition of emergency relative to what it might be in other circumstances. So here we have some really other important language. A treatment may be administered without consent to somebody who's incapable if the health practitioner proposing the treatment, and health practitioner could be a physician, it could be a paramedic even, if there's an emergency as described above here, and the delay required to get that consent or refusal, because substitute decision makers can refuse, that delay will prolong the suffering that the person is apparently experiencing or will put the person at risk of sustaining serious bodily harm. So what does that mean? That means we have a patient and maybe we can figure out who the substitute decision maker is, we can get their information, we can call them, and in theory we can get their consent. But the time to go through those steps are precious seconds or minutes where it's urgent to get this person help because they are suffering so much, or the risk of if their medical issue isn't addressed urgently is so significant. So if there's actually an emergency and the delay to get that consent is going to create prolong the suffering or create this risk, it can be appropriate to treat without the consent of the substitute decision maker. So this is in the context of a patient who themselves lack capacity, and ideally the substitute decision maker would be asked to consent. But in an emergency, things can unfold a little bit differently. Now this one I found quite interesting. So there's a part of the Healthcare Consent Act that addresses what if a patient is capable. In almost every circumstance, capable people cannot be treated unless they consent. We all as patients have a right to refuse. We get to provide informed consent and we can decline. So here's a unique exception in the law when a person is probably capable, but there's a communication required in order for the person to give or refuse that consent, and it can't take place because there's a language barrier, so that they don't speak the same language as the healthcare provider, or the person has a disability that prevents the communication from taking place, and steps that are reasonable in the circumstances have been taken. So maybe a quick phone call. Can a family member translate? What can be done in a really sort of expedited way to try and address this communication barrier, whether it's language or disability related. And then the delay required to actually solve this problem and practically get this communication to happen will prolong the suffering that the person is apparently experiencing or put them at risk of sustaining serious bodily harm. So it's sort of this weighing the, we infringe their rights, but also what's the suffering happening, or what's the physical consequence in the long term, weighing those things, because it's a big deal to treat someone without consent. So it's kind of, again, narrowed how emergency is defined so that it's very limited when this would happen. And there's no reason to believe the person would not want the treatment. So that's going to be a judgment call in an emergency, really difficult to do, but based on body language, for example, gesturing, nodding, moving away versus putting an arm out. So some ways that people can indicate in the moment if they do want that treatment, that can be part of a determination. And part of the sort of underlying context here is that most people probably do want to be helped in an emergency. So if the health professional's in doubt and there's an emergency, the law is letting them err on the side of probably this person does want assistance to address the emergency that they are in, that whatever the healthcare crisis might be. So that's it for this video. I hope you learned something new, and I'll see you in the next one.